Hypertension and stroke, the connection between high blood pressure and stroke risk. Welcome back to our health education series. Today, we're diving into an incredibly important event. So grab a pen and paper, get ready to take notes, and let's explore the fascinating link between hypertension and stroke risk. Are you ready? Let's get started. But before we begin, please like and subscribe to our YouTube channel. Hypertension, also known as high blood pressure, is a medical condition where a person's blood pressure consistently measures 130/80ths mmHg or higher. Blood pressure refers to the force exerted by the blood against the walls of the arteries as the heart pumps it throughout the body. In the case of hypertension, this force is chronically elevated, which can lead to various health complications. The condition is diagnosed through regular blood pressure measurements, and a consistent reading of 130/80ths mmHg or higher indicates hypertension. This means that the pressure in the arteries during each heartbeat, systolic pressure, is 130 mmHg or higher, and the pressure between heartbeats, diastolic pressure, is 80 mmHg or higher. Hypertension is a significant risk factor for numerous cardiovascular diseases, including heart attacks, stroke, heart failure, and kidney disease. Managing hypertension often involves lifestyle modifications, such as adopting a healthy diet, engaging in regular physical activity, reducing salt intake, limiting alcohol consumption, maintaining a healthy weight, and quitting smoking. 2. Impact on blood vessels. When a person has high blood pressure, it means that there is excessive force exerted on the walls of their blood vessels, which can have damaging effects over time. The persistent elevated pressure can cause the blood vessel walls to weaken, thicken, or develop abnormalities, such as plaques or fatty deposits. These changes make the blood vessels more vulnerable to rupture or blockage. Weakened vessel walls may become prone to forming aneurysms, which are bulges that can burst and lead to severe bleeding. Thickened vessel walls can narrow the arteries, restricting blood flow to vital organs like the heart or brain. Additionally, the development of plaques can further narrow the blood vessels, impeding the smooth flow of blood and increasing the risk of blood clots. If a blood vessel becomes completely blocked by a clot or plaque, it can result in a stroke or heart attack. 3. Ischemic stroke. Approximately 87% of strokes are classified as ischemic strokes, which occur when a blood clot forms within a narrowed or blocked artery, leading to a reduction in blood flow to a specific area of the brain. Hypertension or high blood pressure plays a substantial role as a risk factor for the development of blood clots, thereby increasing the likelihood of ischemic stroke. When blood pressure is consistently elevated, it exerts excessive force on the blood vessel walls, causing damage and making them more susceptible to the formation of clots. Additionally, hypertension contributes to the thickening and narrowing of arteries through atherosclerosis, a process characterized by the buildup of plaque made up of cholesterol, fat, and other substances. These narrowed arteries create an environment conducive to clot formation. If a clot forms in one of these narrowed or blocked arteries that supply blood to the brain, it can obstruct the flow of blood, leading to ischemia, insufficient blood supply, and subsequent brain damage. Hypertension further exacerbates this risk by promoting endothelial dysfunction, oxidative stress, inflammation, and platelet activation, all of which contribute to the formation of blood clots. 4. Hemorrhagic stroke. Hemorrhagic strokes, accounting for approximately 13% of all strokes, occur when there is bleeding within the brain. Uncontrolled hypertension plays a significant role in the development of hemorrhagic strokes due to its detrimental effects on blood vessel walls. High blood pressure can weaken the walls of blood vessels over time, making them more susceptible to abnormalities, such as aneurysms or arteriovenous malformations, AVMs. Aneurysms are weakened areas that balloon out from the vessel wall, while AVMs are tangled connections between arteries and veins. The increased pressure from hypertension can cause these weakened areas to rupture, leading to bleeding in the brain. When an aneurysm bursts or an AVM ruptures, blood spills into the surrounding brain tissue, causing damage and potentially triggering a hemorrhagic stroke. The severity of the bleeding can vary, ranging from small leaks to significant hemorrhages. Uncontrolled hypertension exacerbates the risk of these vascular abnormalities by further increasing the pressure on weakened vessel walls, creating an environment conducive to rupture and subsequent bleeding. Managing hypertension is crucial in preventing the progression of vascular damage and reducing the likelihood of hemorrhagic strokes. Controlling blood pressure through lifestyle modifications and, if necessary, medication can help maintain the integrity of blood vessels, minimize the risk of aneurysm or AVM rupture, and promote overall cerebrovascular health. 5. Hypertension and stroke risk. Numerous studies have consistently demonstrated that individuals with high blood pressure are at a significantly higher risk of experiencing a stroke. Hypertension is a major contributing factor that roughly doubles the risk of stroke with each 20 mmHg increase in systolic blood pressure or 10 mmHg increase in diastolic blood pressure. High blood pressure puts added strain on the blood vessel walls, increasing the likelihood of damage, narrowing, and clot formation. The elevated pressure forces the heart to work harder to pump blood, causing the arteries to become stiffer and less flexible over time. This vascular damage and reduced elasticity further contribute to the risk of stroke. The constant strain on the blood vessels can lead to the formation of blood clots that may obstruct the blood flow to the brain, causing an ischemic stroke. Additionally, hypertension can weaken the blood vessel walls, making them more susceptible to rupture and resulting in a hemorrhagic stroke. Moreover, high blood pressure also promotes the development of atherosclerosis, a condition characterized by the buildup of plaque in the arteries, further increasing the risk of stroke. By effectively managing and controlling hypertension through lifestyle changes, such as maintaining a healthy diet, engaging in regular exercise, managing stress, and taking prescribed medications when necessary, individuals can significantly reduce their risk of stroke and promote better overall cardiovascular health. What do you think of our video? Let me know in the comment section below. If you enjoyed this video, make sure to hit that like button. Also subscribe to our channel before you go. Thank you for watching.